DHS means Diabetes and Hypertension Help Society, and basically we provide free community health care, usually focusing on diabetes and hypertension, but we also do a lot of health promotion, so we diversify in other things, you know, whatever we can do to boost the health of people. Provide medication and consultancy and checks for blood sugar and blood pressure. First of all, the processes would be that people would fill in the slip, the information slip, which guides the doctor when they get to the consultancy stage, and then they have their blood sugar checked. Usually we try to target for fasting, or at least 2 hours fasting if it's a random, and then from there they move on to have their blood pressure checked. And after the blood pressure is checked, those who need to see a doctor according to their symptoms and their numbers are sent on to go consult with a doctor. And after the consultation, the doctor makes a prescription for them, and we're giving away free medication on high blood sugar, high blood pressure, malaria, stress and pain, and lots and lots of blood capsules, because there's a lot of anemia going on in rural areas. I think the common denominator in all these places, having worked in villages in the northern side of the country, in the southwest part, we've been in Ekiti, and also in the southeast, going to Ebonyi State, the common denominator is that there's a lot of high blood pressure. There's a lot of high blood pressure. In some communities, there's a lot of high blood sugar as well, because of the diet and the lifestyle. In some other communities, we find low blood sugar because of the poverty. People are not eating well, and the alcoholism. There's a lot of alcoholism in rural communities. So this causes them to have anemia and also to have low energy, and in cases where the alcoholism is just starting, it will give them a high blood sugar. So we notice a lot of high blood sugar, and then there's a lot of eye diseases and complications coming from high blood sugar, you know, glaucoma and things like that. And also chronic pain, because these people are farmers and these people work with their hands and their back under the sun. So they have a lot of chronic pain, which ultimately gives them ulcer. So there's a lot of ulcer going on as well.
Well, I think the experience yesterday was very remarkable. First of all, in terms of the turnout of people, you could see that the villagers really embraced the initiative and they came out in their numbers. It was very massive. We examined a lot of patients, and incidentally, many unknown hypertensives were discovered yesterday, and many unknown diabetics were discovered. We counseled them and then gave them drugs for further follow-up in the center.
Well, DHS is basically a Nigerian-German initiative. So we've had a lot of support from the Germans, coming from the German front. Glucometers, our strips, the German embassy have also pitched in and supported us. The companies and organizations operating in Nigeria with a German background, you know, the Julius Bergers, the Cetracos, and so on, have all been very helpful. And DHS is also always seeking to expand our partnership. Like we're starting something in the UK. We also have plans to do a research partnership with some organizations in the US. There can't be too much partnership. We need a lot of partnership to do what we're doing, especially expanding the program into giving free medication, which is very, very important, because it's one thing to educate these people. It's another thing entirely for you to tell them this is what they should have, and not be able to give it to them. It's just halfway. But if you're doing that in the urban areas, in the cities where people have income, it's a lot easier. But when you go into these rural areas where these people have zero income most times, or very little income, you have to go equipped with more to give than simply advice on diet and lifestyle. So we're open to every kind of partnership, and we keep seeking new partnerships to do what we did.
Doctor official na nkete def yemuge gbanya achọkwuru m ịfụ doctor ọzọ ka onenegbuo m arụ ana nnesi ndị mmadụ ahụ ka mmadụ ahụ na-adị ma ndị anya na-ebu ma onye ọbụla onye ọ na-aya n'ebe ọ na-aya a na-eme ka mara ihe na-aya onye ahụ onye oje na nke dọkịta onene ya ojikwa na nke ndị na-afụ maka anya ha gosi ihe ọ ga-agụ ọ bụrụ nke nnukwu ọ bụrụ nke obere ka onye ahụ agụta ojezie na nke dọkịta wee nye ya glaasị enyekwa mụnwa ofu glaasị
uwe ya bara anyị bụla nwaanyị ta ọkwụ abịa jekewara nwere ndị ọkwụ igwere emekwe ka gị gawa ma si solo abịa lọwa na-abịa nta abanye kwụrụ ọ ka ga-ebeta danụnụ na anụ.
If people that have been representing us have been doing this kind of a thing, the number of the people we have here that are hypertensive and diabetic patients wouldn't have been so. But because nobody has been doing that, you find out that 90% of the people that came here have one problem or the other, and they are well attended to. And I am happy for such exercise. The importance of this to my people is that the death rate will be drastically reduced. A lot of people have died here as a result of hypertension and nobody knows that. A lot of people have died here as a result of diabetes and nobody is aware because they find it extremely difficult to go to hospital. You even find it difficult to convince them there is a need for one to go for a medical checkup, especially when one can wake up in the morning and attend to his farm duty. He believes that all is well, and that is the mentality of my people.